This video is about the demonstration of scapula, also called the shoulder blade, which is a thin and a flat bone which is placed on the posterolateral aspect of the thoracic cage. The scapula has got two surfaces, three borders, three angles and three processes. For the site determination, the lateral or the glenoid cavity should be placed facing laterally. The dorsal surface is convex and is divisible by the attachment of the spine into a supraspinous and an infraspinous fossa. The thickest or the lateral border should be placed on the lateral side. The features on the scapula. The two surfaces are the costal surface or the subscapular fossa, which is concave, and it is marked by three longitudinal ridges. The dorsal surface gives attachment to the spine of the scapula, which divides the surface into a smaller supraspinous fossa and a large infraspinous fossa. The two fossas are connected by the spinoglenoid notch. The three borders are the superior border, which is thin and short and presents a notch called the suprascapular notch. The lateral border is thick. The medial border is thin, extending from the superior angle to the inferior angle. The angles are superior angle, which is covered by the trapezius, the inferior angle, which is covered by the latissimus dorsi. The lateral or the glenoid angle is broad and bears the glenoid cavity. The processes are: the spine or the spinous process is a triangular plate of bone with three borders and two surfaces, which divides this dorsal surface of the scapula into a supraspinous fossa and an infraspinous fossa. The posterior border is also called the crest of the spine. The crest has got upper lip and a lower lip. The acromion process has got two borders, medial border, which is continuous with the upper lip, and a lateral border, which is continuous with the lower lip. It has got two surfaces, the superior surface and an inferior surface, and a facet for the clavicle. The coracoid process is directed forwards and slightly laterally. It is bent and finger-like. Attachments on the scapula. The multipinnate subscapularis muscle, it arises from the medial two-thirds of the subscapular fossa. The supraspinatus arises from the medial two-thirds of the supraspinous fossa, also from the upper surface of the spine. The infraspinatus arises from the medial two-thirds of the infraspinous fossa, also from the lower surface of the spine. The deltoid muscle, it arises from the lower lip of the crest of the spine and also along the lateral border of the acromion process. The trapezius is inserted along the upper lip of the crest of the spine and along the medial border of the acromion. The serratus anterior muscle is inserted along the medial border to the costal surface, one digitation from the superior angle to the spine, opposite to the spine, second two digitations onto the medial border, and the 5 digitations to the inferior angle. The long head of the biceps arises from the supraglenoid tubercle, and the short head of the biceps arises from the tip of the coracoid process. The coracobrachialis muscle, it also arises from the medial part of the tip of the coracoid process. The pectoralis minor muscle is inserted into the tip of the coracoid process. From the infraglenoid tubercle, the long head of the triceps brachii arises. Along the lateral border, the teres minor, it arises from the upper two-thirds on the dorsal surface of the lateral border. The teres major, it arises from the lower one-third on the dorsal aspect of the lateral border. Attachments along the medial border. The levator scapula is inserted along the dorsal aspect of the medial border from the superior angle up to the root of the spine. The rhomboides minor is inserted into the medial border opposite to the root of the spine, and the rhomboides major is inserted up to the inferior angle. The inferior belly of the omohyoid, it also arises from the upper border near the suprascapular notch. The margin of the glenoid cavity gives attachment to the capsule of the shoulder joint and also to the glenoidal labrium. The acromion process gives attachment to the acromioclavicular ligament and also to the capsule of the acromioclavicular joint. The transverse humeral ligament, which bridges across the suprascapular notch and converts it into a foramen. For the clinical anatomy, paralysis of the serratus anterior, which is supplied, causes winging of the scapula. In the winging of the scapula, the medial border of the bone becomes prominent and the arms cannot be abducted beyond 90 degrees. So at the end of this video demonstration, the student should be able to identify the given bone, the site determination, anatomical position, attachments on the bone, and also its clinical applied.